ಹೆಸರು ಉಷಾ ರಾಣಿ. ನನ್ನ ವಯಸ್ಸು 60 ವರ್ಷ. ನನಗೆ ಮೊನೋಪಾಸು ಸ್ಟಾಪ್ ಆದಮೇಲೆ ಪೀರಿಯಡ್ ಸ್ಟಾಪ್ ಆಯಿತು. ಆಮೇಲೆ 1-2 ವರ್ಷ ಆದಮೇಲೆ ನನಗೆ ಬ್ಲೀಡಿಂಗ್ ಸ್ಟಾರ್ಟ್ ಆಯಿತು. ಆಮೇಲೆ ನಾವು ಯಾರನ್ನೋ ಕೇಳಿದ್ವಿ ನಮ್ಮ ಫ್ರೆಂಡ್ಸ್ಗಳನ್ನ. ಅವರು ಇಂದು ಬೆಂಗಳೂರಿನಲ್ಲಿ ಫೋರ್ಟಿಸ್ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಗಾಯತ್ರಿ ಮೇಡಮ್ ಇದ್ದಾರೆ, ಅವ್ರು ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ, ಅವ್ರನ್ನ ಮೀಟ್ ಆಗ್ರಿ ಅಂತ ಹೇಳಿದ್ರು. ನಾವು ಅವ್ರ ಫೀಡ್ಬ್ಯಾಕ್ ಎಲ್ಲ ನೋಡಿದ್ವಿ ಮೇಡಮ್ ಅವ್ರದ್ದು, ನಮಗೂ ತುಂಬ ಇಂಪ್ರೆಸ್ ಆಯಿತು. ಅದಕ್ಕೆ ನಾವು ಮೇಡಮ್ ಹತ್ರ ಬಂದು ನಮ್ಮ ಸಮಸ್ಯೆ ಮೇಡಮ್ಗೆ ಹೇಳಿದ್ವಿ. ಮೇಡಮು ಈ ವಯಸ್ಸಿನಲ್ಲಿ 60 ವರ್ಷ ಬ್ಲೀಡಿಂಗ್ ಆಗಬಾರ್ದು, ಬಟ್ ಏನಾದರೂ ಇರುತ್ತೆ ಸಮಸ್ಯೆ ಅಂತಂದರು. ಏನಾದರೂ ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ ಇದೆ ಇರ್ಬೋದು, ನನಗೆ ಡೌಟ್ ಇದೆ ಅಂದರು. ನಾನು ಬಾಧೆ ಪಡೋ ಟೈಮ್ಗೆ ಡಾಕ್ಟ್ರು ತುಂಬ ಧೈರ್ಯ ಕೊಟ್ಟರು. ನೀವು ಬಾಧೆ ಪಡಬಾರ್ದು, ತುಂಬ ಧೈರ್ಯವಾಗಿರಬೇಕು. ಅವರು ಎಷ್ಟು ಚೆನ್ನಾಗಿ ನನಗೆ ಹೇಳಿದ್ರು, ಅದರಲ್ಲಿ ನನಗೆ ಪಾಸಿಟಿವ್ ಬಂತು. ನನಗೆ ಅವ್ರು ಮಾತಾಡೋದ್ರಲ್ಲೂ ಅದೆಲ್ಲ ನನಗೂ ಸ್ವಲ್ಪ ಪ್ರೀತಿ ಆಯಿತು, ನನಗೂ ಅವ್ರ ಮೇಲೆ ವಿಶ್ವಾಸ ಆಯಿತು. ಅವ್ರು ಹೇಳಿದ್ರು ಅದಕ್ಕೆ ಹಂಗೆ ನನಗೂ ಸರ್ಜರಿನೂ ಚೆನ್ನಾಗೇ ಮಾಡಿದ್ರು. ರಿಪೋರ್ಟ್ ಬರಬೇಕು ಅಂದರು. ನನ್ನ ಆಂಕಾಲಜಿ ಇದರಲ್ಲಿಗೆ ನೀತು ಮೇಡಮ್ ಅವ್ರ ಹತ್ರ ಕಳಿಸಿದ್ರು. ಅವ್ರು ಕೂಡ ತುಂಬ ಡೀಪಾಗೆ ಎಲ್ಲನೂ ಅವರು ಟೆಸ್ಟ್ಗಳೆಲ್ಲ ಮಾಡಿಬಿಟ್ಟು ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ ಇರೋದು ನಿಜನೇ, ಆದರೂ ಅವ್ರು ಕಂಪ್ಲೀಟಾಗೆ ಸರ್ಜರಿ ಮಾಡುವಾಗ ಕಂಪ್ಲೀಟಾಗಿ ಎಲ್ಲ ತೆಗೆದಾಕಿದ್ದಾರೆ. ಅದರಿಂದ ನಿಮಗೆ ಏನು ಪ್ರಾಬ್ಲಮ್ಮು ಇಲ್ಲ. ಇಷ್ಟು ನನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ಜರ್ನಿಯಲ್ಲಿ ಡಾಕ್ಟ್ರು ನನಗೆ ಕೊಟ್ಟರ ಪಾಸಿಟಿವ್ ಅವ್ರು ಕೊಟ್ಟರ ಧೈರ್ಯದಿಂದ ನನಗೆ ತುಂಬ ಟೆನ್ಷನ್ ಇಲ್ಲ, ಏನಿಲ್ಲ. ನಾನು ನೆಗೆಟಿವ್ ಥಿಂಕೇ ಮಾಡಲ್ಲ, ಪಾಸಿಟಿವ್ ಥಿಂಕ್ ಮಾಡಿಕೊಂಡು ಅಷ್ಟೇ ಧೈರ್ಯವಾಗಿ ನಾನು ಎಲ್ಲರಿಗೂ ರೆಸ್ಪಾಂಡ್ ಆಗಿಬಿಟ್ಟು ನಾನು ಇದರಲ್ಲಿ ಚೆನ್ನಾಗಿ ಮಾಡಿದೆ. ಟ್ರೀಟ್ಮೆಂಟ್ ಜರ್ನಿನಲ್ಲಿ ಡಾಕ್ಟ್ರು ಮಾತ್ರ ನಾನು ಸೆಲ್ಯೂಟ್ ಹೇಳ್ತೀನಿ. ಡಾಕ್ಟ್ರು ಪ್ಲಸ್ ಸ್ಟಾಫು ಎಲ್ಲರೂ ನನಗೆ ತುಂಬ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ದಾರೆ, ನನಗೆ ತುಂಬ ಕೇರ್ ತಗೊಂಡಿದ್ದಾರೆ. ಅವರೆಲ್ಲರಿಗೂ ನಾನು ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ತೀನಿ.
Hello everyone, this is Navya. I'm from Bangalore. My mom Usha had post-menopausal bleeding. We have, searched the doctors in the online, and even we have approached our family and friends. They have referred, Dr. Gayathri madam, a very compassionate and then the patient-friendly doctor. The journey was very smooth, and all the hospital staff and doctors are taking care at every moment, and then they've been very friendly. We were, at whatever might be, it is a small or a bigger concern, whenever we needed, the staff was available for us. And I would like to thank all the doctors and staff, and especially Gayathri madam and Neetu madam for being, strength to my mom, which made her to believe in you guys and gone through the surgery very bravely. And you guys has just given the smile on all our family members. Thank you everyone.
Hello, I'm Dr. Gayathri Kamath, the senior consultant at Fortis Hospital, Bannagatta Road. So it's about Mrs. Usha Rani, who's a 60-year-old who came up to me with an episode of post-menopausal bleeding. Normally, when women at this age group come to us with bleeding, we evaluate them by an ultrasound, a pap smear, and then we offer them a test called endometrial biopsy if we see that the lining of the uterus is on the thicker side. In her case, the ultrasound revealed the lining to be thick, and hence we decided to do an endometrial biopsy. Now, in such situations, the gold standard test is to do a hysteroscopic biopsy, where a lady is taken to the operation theatre, and under anesthesia, we evaluate them thoroughly and send the material for a histopathological evaluation. But when we do a hysteroscopic biopsy, generally a woman has to get admitted. The procedure is done under general anesthesia, and she will have to stay in the hospital for over 3/4 of the day. Now, Usha Rani had a situation at home where she had an elderly son who was past his 30s, and he was completely dependent on her on account of his health condition. She had her husband to look after. In the process, she had a lot of commitments at the domestic front. So getting her admitted for a hysteroscopic biopsy was not a very feasible option. She wanted the removal of the uterus to be done at one sitting. So I explained to her that she may not need a removal of uterus if the biopsy turns out to be benign. So we decided to do an office biopsy, which was a procedure which was done in the outpatient. So this lady did not have to get admitted. It was done in an outpatient manner, and the biopsy was sent to the lab. The lab report came as inconclusive because the material obtained and the cells they were trying to analyze, they could not conclude anything. And then instead of choosing a hysteroscopic biopsy, she decided to go in for a removal of the uterus. This was also in her mind because she had repeated episodes of these kind of bleeding after her menopause had set in. So then when we decided to post her for a surgery, she was very concerned as to how long she will have to be taking bed rest, because she was almost managing the whole show at home, taking care of her husband and her elderly son. Now putting this together, we decided to think of a minimal access procedure like a laparoscopy, and then we posted her for a laparoscopic hysterectomy. Considering that we didn't have a very clear biopsy report, I had this thought in mind: if we were dealing with a malignancy within the lining of the uterus, what we call an endometrial cancer. So before surgery, we subjected to an MRI procedure, and an MRI did not reveal anything sinister. So we posted her for a laparoscopic hysterectomy, and the procedure was done under anesthesia, and everything was done by keyhole. And just to be doubly sure, we even removed the lymph nodes, because if the final report came up to be an endometrial cancer, she would need another surgery. So presuming that there is a small possibility of an endometrial cancer, so we removed her uterus and we sent it for something called a frozen section, where while the lady is under anesthesia, we get the report from the pathologist. So we got the report that there were slight chances of having endometrial cancer, and hence we removed the lymph nodes as well. And then the final report did come as endometrial cancer, but thankfully this was limited to the inner layer only, and she did not need any kind of adjuvant chemotherapy or radiotherapy. Now the reason why I am telling Mrs. Usha's story is because one thing is, postmenopausal bleeding should not be neglected. And the second important thing I realize is, for a lady to do well after surgery, she should be mentally prepared. Number one, she should know completely the course of treatment she is likely to undergo, and she should be told clearly about the recovery path. In her case, she had a morbid fear that she should not be dependent on anybody and she should resume normalcy the moment she goes back home. And with the joy of laparoscopy, she managed to do everything. And you must have heard the story from Mrs. Usha Rani herself. So I'm so glad for Mrs. Usha, because her biopsy has come as an endometrial cancer which is limited to the inner lining. There was no spread anywhere and the timing was picture perfect, and she has had a brilliant recovery. So, I think the mental makeup is also important, and it's the timing which they came in was also made life very pleasant. She doesn't need any chemotherapy or radiotherapy sessions, and she has bounced back to her normal life. Thank you very much.